It is Mental Health Awareness Month, and we know that the pandemic has taken a toll on everyone's mental health, some more than others. But this morning, we are talking about the mental health of children. So joining us now is Dr. Stephen Pliszka from University Health. Hi, good morning, doctor.
Good morning.
Thanks for joining us. Well, growing up has always been hard, and depression and anxiety are not new to that experience. But in recent years, the numbers have been increasing, and we are seeing more severe cases. Why is that?
Well, I think there are a variety of causes. I mean, the increases in depression and anxiety occurred well before the pandemic, and the pandemic situation it provided some stressors that have just made the situation more difficult. I think there are several factors that are going on in our society. I just think kids respond to the overall higher levels of stress in society that have been present for the last decade or so. People's uncertainty about their jobs, parents being more stressed out, greater competition for places in college and positions on sports teams. Used to be a kid could play, football, basketball, and track. It was just kind of a fun thing to do. Now people compete for the position on the sports team or the dance team or getting into the college that you want to go to. You have to be in the top 10% of your class. And if you're not a top 10% person, what are you going to do? You might have, generations ago, you still would have gotten a good job making a middle-class salary. And I don't think kids, they don't come in and articulate these kind of sociologic problems, but I think it has, it weighs them down. So I'm not doing well in school and what's the point? Social media plays a role as it's a huge distractor from the normal developmental tasks of adolescence. So instead of hanging out with friends or doing their homework, the temptation is to always be on the phone, looking at YouTube videos, texting with people. And for those who already have some tendency to depression, that can unfortunately reinforce depressive tendencies, either through people run into negative feedback, telling them bad things about themselves, or even getting onto sites that can glorify depression or glorify suicidal thinking. So we really are in a very difficult situation, and it calls for not only obviously more treatment, but also for all of us as parents and as community leaders to kind of look at the sort of society that we're raising children in.
Yeah, a lot of challenges for young people out there. And are the numbers of children in crisis going down or getting better as pandemic restrictions go away and children return to school?
I wish I could say they were getting better, but that is not the case. The number of referrals we get continues to go up, and I think a lot of kids are struggling with the return to school. They got used during the pandemic to staying home, only being a few hours online for classes. The work was substantially easier. And now they back in school, they have to navigate all the stressors of dealing with peers. And they're just not used to working as hard. And we're seeing this not only at the middle school and high school level, but even at the college level as well. So our referrals are not only in young children, but in young adults. And it's difficult for therapists to work with because people say, well, I'm depressed because, I just can't stand to get up in the morning. I can't stand going to work. I don't want to study. And getting people back into the frame of mind that if you want good things, you do have to put these efforts into it. If you take some baby steps, it's not so bad. It's a different focus of therapy than in the past, which used to be solely on, events that may have happened, within your immediate family. So I think therapists are really having to scramble to keep up with the situation.
And Dr. Pliszka, what should parents or guardians do if they see some troubling signs of mental distress?
Well, I think communication is key. If you're on your phone all the time, or you're doing social media or watching TV, and your kid is off in the room by themselves, that's an at-risk situation. So really do try to organize meals together, limit the amount of social media that your kid is exposing themselves to, and talk about it and look at it and make sure that they're not engaged in a lot of negative social media. if kids are showing signs of depression, you should reach out for help with a professional, but I'll admit that that's often difficult. A lot of therapists don't have openings. You've got to go through the list of providers on your insurance panel, and you've got to keep calling each of them. Sometimes you have to go outside your insurance, pay out of pocket, and you have to change your work and school schedule and activity schedule so your kid can be available, for the therapy when it's offered. Be an active participant in the therapy. If you're, it's not just dropping the kid off for an appointment and and hoping things will be better. Engage in some family therapy, opening up communication, among family members.
All right, Dr. Pliszka with University Health, thank you so much for joining us this morning.
It's been my pleasure. Thank you.